Welcome to USA Boxing's Ringside Physician Guide. My name is Dr. Rodney Muhammad. I'm a licensed practicing physician in Colorado Springs, Colorado. I do family practice and sports medicine. I've also been working with USA Boxing for about the past 9 years. I've done national and international tournaments with USA Boxing. I'm certified to be at the Olympic Training Center to monitor USA Boxing sparring sessions, and I have an AIBA International Ringside Physician Certificate. Let's talk about what it would take for you to be a ringside physician for USA Boxing events. First and foremost, you have to be a licensed practicing physician in the United States, meaning a doctor of osteopathy or a medical doctor. You should also have liability insurance. Now, once that's in place, the process to become a ringside physician is a background check and membership. Once that's done, you can take the Ringside Physicians course that we offer each year, or you can watch these videos and apply to be a ringside physician at an event. What kind of boxers are you going to be encountering? Anybody from 8 to 80, but mostly 8 to 25 or 30 years old. We do have a master's division, but those occurrences are rare. Within the 8 to 30-year-olds, we have all the weight divisions that you would expect to find at a major boxing event. And they're very well trained and very well coached. What you're expected to do at these events is pre-participation physical examination, ringside duties, which would include basic CPR and first aid, and then post-bout physicals that may also include suspension paperwork. So with that in mind, let's take a look at what you should expect pre-bout, what to have in your bag, and what to expect when you get to the venue with that bag. So before you come to the event, you want to make sure that you have a well-packed medical bag. What do I mean by well-packed? Basically, a first aid kit that's traveling with you. When you get to the event, you're going to have two different setups, one for the pre-fight physical and one for ringside. Let's take a look at what we have as an essential items for a pre-fight physical exam. Over here, I have an automatic blood pressure cuff, because sometimes I have an assistant who can aid in doing vitals while I'm doing other things. This is a regular size blood pressure cuff that we use in case this one either goes down or I don't trust the results. Okay? This is a smaller size blood pressure cuff for the smaller size boxer, and this is a larger size for our light heavyweights and heavyweights. Of course, we also want to have an ophthalmoscope, otoscope with speculum, reflex hammer, of course a writing utensil, pen, preferably latex-free exam gloves, and that's pretty much it. That's what you need for a pre-fight physical exam. Now for ringside, what I'll usually bring to the ringside with me is a fanny pack that'll contain some or all of these materials. For example, latex gloves, a nice strong pen light, some athletic tape, clean gauze for checking bloody lips and noses, a tongue depressor, extra bandage or two, and then for those bloody noses, a little bit of Vaseline and mini tampons with oxymetazoline to control bleeding. And we'll also have a pair of scissors to cut gloves and tape off. Now, personally, when I sit ringside, because the lights bother my eyes, what I'll do is I'll bring a pair of sunglasses that are prescription. Because when you're looking up into a ring for 3 and 4 hours at a time, you can get a headache. Now, these are prescription lenses, so I'm not missing anything. Now, when you get to the venue where the event is going to be held, you want to meet first with the emergency medical technicians and develop some kind of hand sign that will let them know that you need assistance. Make sure that you know where the exits and entrances are, and make sure they're not blocked so that you can get the fighter out of the auditorium as quickly as possible. Now, the officials are going to seat you where they need to seat you. You'll usually be at a neutral corner with some stairs, so when the boxer comes down, you can do your post-fight physical exam. Other things to remember at ringside are to have a cell phone. That's in case you have to evacuate anybody to a hospital. You can give the ER a call, make sure that they have a neurosurgeon on staff, or just give them a heads up about what's happening, and then you can follow up a lot better. So, on the day of competition, our primary goal is the safety of the boxer, and therefore there are some disqualifying conditions that you have to check for. Most of these can be found in their passbook as part of their annual physical exam. If they've gotten past the annual physical exam, it's a pretty sure bet that they're okay to box. But let's go over some things that can happen the day of or the day before the competition. Now, imagine you're in your office and you have a patient in front of you who's coughing, has fevers and chills, there's a lot of discharge from the nose. Are you going to let that person go to work? Probably not, so why would you let them box? Use common sense, good medical evaluation, and you should be okay with that kind of thing. The things that are specific to boxing, including concussion. Symptoms of concussion should be checked on every fighter that comes through. They may have won the bout the day before, but they still took a significant blow. So always check for blurry vision, ringing in the ears, dizziness. Okay? Also, in a multi-day competition, you may have someone that got a cut over the eye, a cut across the lip that couldn't get closed. They can't fight the next day. Also, and most importantly, anybody who suffered a concussion, or maybe they may have won their bout, but they got a couple of good shots. So you want to make sure that you always assess for concussive symptoms. Now, if you find those, you want to be judicious about it. Consider the elevation you're at, consider dehydration aspects, and really look for those red flags that pop up like dizziness, ringing in the ears, and blurry vision. Now, we mentioned deaf boxers in our handbook. They can still box. The only restriction is that they can't have an implantable device in the skull that will allow them to hear. Just let the referee know that the boxer is deaf so he can give signals and look in the boxer's eyes to make sure he understands the signals that are being given to him. Other things are musculoskeletal problems, significant, severe thumb pain, wrist pain, hand pain, and of course, the visual acuity. It's discussed in the handbook, but in any sport, visual acuity is very important. When the boxer has to focus first at something coming at him, just for a split second, sometimes that's all it takes to be at a disadvantage. So explain that to the boxer who does not meet the visual requirements that we've already discussed. So it's the day of the competition. These physical exams usually take place very early in the morning, and these kids are hungry. So when you walk in, be ready to get right to business. As you walk into the room, walk in with confidence and walk in with authority. Start scanning the room for any particular problems. Now, male and female should be separated. Female should be done first, and male should be done second. And you should always have an escort when you're doing a female exam. Now, when you get into the room and you have your table, make sure your table's set up, then you can start doing your examinations. Now, the kids will come up with their passbooks. Open the passbook, check the photo, and then start scanning about, well, they had a knockout, they had a TKO, ask them where they're from, try to break the ice a little bit. So let's go ahead and start doing that now, and I'll show you some of the essentials I use in my pre-fight physical exam. Now we have a model over here who's going to help us go through this. So when we come up to address the patient, you want to start looking immediately. Take off hats, glasses, check for braces or retainers right away so you can start planning to ask about that. And then check the body posture. Do they look sleepy or tired? Do they look dehydrated? Okay? So let's just go through the exam. I like to start with the head and to just scan down. Okay? So, how are you doing this morning? Feeling okay? Take the passbook, make sure it's the same person, look at some of the data, anything significant, and if not, let's get started. Okay? So, any dizziness, blurry vision, ringing in the ears, headaches? Have you had any significant blows to the head in the past 6 to 8 weeks? Okay. So I noticed you had on glasses before. Do you wear contacts? Okay, fine. Have you had any significant blows to the nose? Any nosebleeds recently? Okay. Any problems with the mouth? Do you wear a retainer? Okay, so what I'm going to do now is just go ahead and start the cranial nerve exam. So just follow my finger with your eyeballs. Don't move your coconut, right? So he knows what a coconut is. So here's the smile. That's a cranial nerve, right? And inside here. And I'm going to get any deep cavities or abscesses, split tongue, cuts inside the lip. I'm looking at the ears, looking for cauliflower ear or hematomas. I'm also looking for hematomas of the face. Okay? Then I'll ask him to show me the mobility of his neck. So can you go all the way down and all the way back? All the way back. Back to me, head this way, then the other way. Okay. Now, ear to shoulder and ear to shoulder. Now, what a lot of docs will also do is check the tympanic membrane. Make sure there's no rupture or any infection. Okay, and then into the nose. Here, okay. Now we're going to check the upper extremities. Very quick check. Can you reach across like this? And back across like that. Okay, and up and over. And back like here. Now I'll do that on both sides. And once we have both sides done, thumbs up, I'll do the empty can test. So push up. I'm checking for shoulder problems here. Now turn over. Shoulder problems again. And relax, right? Now I want you to make a fist, okay? Let's see how strong you are. Don't let me open your fist, okay? So now I'm checking the fingers for muscle strength and any kind of problems. Now spread them like that. And of course, the most common problem in a boxer, first phalange, and checking for the scaphoid. No pain there. Now go ahead and squeeze my thumbs nice and tight, okay? Now I want you to push up, push down, push out. Good, okay. Now that's pretty much the upper extremity exam. Now, before we actually start the physical exam, they're gonna have their blood pressure, heart rate taken. We don't usually check for temperature, but we'll check for respirations, and that'll be done with the equipment I showed you before. Now, so part of the exam that we're also gonna check for the upper extremities is reflexes. Just relax your arm, nice and relaxed. There we go. Okay, and here. Okay, let's check this one. Okay, and here. Okay. Now, with the upper extremities done, now we're going to check for the most important part, and that's the cardiac exam. Most physical exams on athletes at this level of competition are to make sure that we don't have any hypertrophic cardiomyopathy. So one of the main questions you ask, usually at an annual physical exam, but you can do it at the pre-fight, is have you ever had anybody in your family die suddenly before the age of 50 while engaged in a physical activity? Okay? Have you ever had dizziness, couldn't keep up with the rest of your peers when you're doing physical activity? Okay. What I'm checking for is hypertrophic cardiomyopathy signs and symptoms and family history. Right. Now this is where I'll spend a lot of time of a quick exam. Now you're going to hear athletic hearts with these kids because they've been training for weeks, months. The heart rates are pretty low. You're going to hear incidental murmurs that don't have any significance. But if you do, go ahead and do the rest of the cardiac exam, for example, stooping down and checking for ventricular hypertrophy. Okay? Now for a lower extremity exam, it doesn't take a whole lot to do a lower extremity exam for a pre-fight physical. So what I'm going to ask you to do is squat down. Okay? No help. And then come back up. And then bend down one more time. And then jump up. Okay. All right, next thing we're going to check is ribs, spleen, kidney, stomach. Okay? You don't have to go through a complete abdominal exam for a pre-fight physical. That should have been done in the annual physical. Now I'm going to ask you to hold your arms out like this. So I'm going to push you a little bit here and check your balance. Little round bird. Okay. Okay. And then hands down, hands on the hips. what you do is raise one leg and bring the knee to the inside like that. Let's check your ability to balance. And you can hold this for 5 to 10 seconds. And he seems to be doing just fine. Okay, back now. So that's the basic physical exam for pre-fight physical. This guy is good to go. Let's talk a little bit about referees and judges. Now, the referees need to have an annual physical exam to stay qualified. Now, before a bout, they need a pre-physical examination also. What you're doing the day of the bout is checking for general fitness before they get into the ring. What you want to focus on are any chronic medical problems or any problems that seem to be an acute process going on, like an infection or bronchitis or a medical condition that they have that's controlled, but now it's uncontrolled. And then just use your common sense. If you were in your office and somebody came in with a really bad cold or bronchitis or flu or a fever or an irregular heartbeat, you wouldn't let them go to work. If you wouldn't let them ride a bike or take a brisk walk, don't let them in the ring. What you really want to check for is vision, heart rate, blood pressure, and respirations. Once you've cleared them for that, they're good to go. Now let's talk a little bit about when it's time for the physician to enter the ring. First thing to do is to keep your cool. Everybody's going to be focusing on you as you enter the ring, so always enter with authority and confidence. Now, the first instance is when a boxer usually takes a bloody nose shot, nose is bleeding badly, profusely. The referee's worried about the fighter, so he may call you up onto the apron to take a look at the bloody nose. Take along your exam gloves, pen light, and some gauze. You're not to treat the fighter, you're to evaluate. If he doesn't have any gushing or arterial flow, it's all venous, let the bout continue. Most nosebleeds look worse than they are, and very few fights are stopped because of them. The second instance is when the referee sees something unusual with a fighter and calls you in to evaluate on the apron. Can this boxer continue? Do a cranial nerve check, do a neural check, talk to the boxer, ask the official what his concern is. If you think he's okay to box, let him continue. If he's not, stop the bout. Third condition is boxer goes down. Referee calls you in. Go as quickly as you can. Now remember, when you're entering the ring, all eyes are on you. You have to stay calm, confident, cool, and be in charge. Nobody else is allowed in the ring except the local physician who may be there with you, may not be with you, the referee, and the EMTs if you call them in. No coaches, no parents. If they try to come in, reassure them that you're doing your job and stay confident, focused, and in control. The last and most unfortunate and most rare occurrence is when the physician has to stop the bout because the boxer is taking significant blows to the head and body that are unanswered, and the referee has not stopped the contest, and it's obvious that the boxer is outmatched. You have the right to stop the fight at that point. It's very rare. It'll probably never happen to you, but don't be afraid to do it. Remember, the safety of the boxer is paramount. You're the physician, you're in control of the ring. So if you see somebody taking significant blows that aren't being answered, stop the fight. Now let's talk about cuts. This is a very complicated, complex area for some people, and for others it's not. Let's go with some general rules of thumb. If you look at the face and draw a line down the middle of the eye, anything medial to that line is a serious issue. Most times lateral doesn't really count, even if it's a deep cut, as long as it's not obscuring the vision. If the bleeding is not obscuring the vision, the boxer can continue. Serious injuries include anything over the supratrochlear, infratrochlear, lacrimal duct, supraorbital, infraorbital, supratrochlear. Lacrimal duct, bridge of the nose. Vertical cuts on the vermilion border, either inside or outside the lip. There's a big difference between a cut over the eyebrow and a cut over the tarsal plate of the eyelid. Now there's some books that will show you a picture that says any cut here, stop the bout. But what they're trying to show you actually is the tarsal plate here. A cut here, stop the bout. A cut here on the eyebrow or just below it's okay to continue, as long as it's not bleeding so much that it obscures the boxer's vision. Another important aspect of cuts is how they're closed and whether a boxer can continue or not with a cut. So let's talk about 3 scenarios. First scenario is the cut is severe, significant, you stop the bout, send them to the ER. The second scenario is it's not significant, but you don't feel that you have the skill or want to take the risk of closing, send to the ER. Let's look at another scenario where you have a boxer who's won the bout but sustained a significant cut in a non-critical area. You feel that you have the skill to close it, so the best bet there is subcuticular sutures, 4-0 or higher. 6-0 is best, but it can be kind of a daunting challenge to close that kind of wound. You can put steri strips over that, and the next day at the pre-fight physical exam, they're evaluated again, and if it's closed, it's healing, they can actually box again. Now let's talk a little bit about the worst case scenario, the unconscious boxer or the momentarily stunned boxer. The unconscious boxer has taken a significant blow and has landed either on his back or his face. You don't really need the referee to call you in. Now the rules say that he can give him an 8 count or start to count the boxer out. But once they're down and the referee realizes they're not getting back up, they'll usually stop the bout and call you into the ring. When they go down, you're out of your seat, 1 foot on the stairs. The referee doesn't call you in, you can come in anyway. Let's talk about the unconscious boxer. Hopefully they're on their back. Sometimes they're not, sometimes they're face down. When you come in, remember CPR, ABCs. Can you hear me? Can you hear me? Check for pulse, no breathing, time to call, EMT, stretcher, oxygen, neck collar, in the ring, now, give them the sign, whatever you got. Assistant doctor, in the ring, now, at the head. Now, if the boxer's unconscious and breathing, you still want to call these people in. And you're probably going to have to do a log roll if they're face down. If they're not, you still want to stabilize that neck with a collar and start all the emergency procedures and get them out of the ring. That's a pretty simple case scenario. You just have to remain calm, confident, and take charge. Now, let's talk about the stunned boxer. Let's say he went down and it looks like he's out, and you've called everybody in that you need in the ring to help, but they start to come back around within 30 seconds or so. They may struggle with you. They may fight with you. So just try to reassure and calm the boxer and use the referee to help control them. Say, look, I'm the doctor, stop, I'm the doctor, stop. Go through your cranial nerve check with your pen light. Go through your questions about who you are, where you are, what has happened. Once they're stable enough, if you feel so, you can raise them up. You don't always have to put the collar on. Especially ask them to move their fingers, move their toes. If they can do that, they're probably intact. Never ever, however, compromise the safety of the boxer for getting them out quickly. Use good common medical sense. Nobody can ever fault you for that. So when they're able to sit up, sit them up. When they're able to stand them up, walk them to the neutral corner, and never let them get out of the ring alone or unassisted. Then they should be put into a holding tank where they can be further evaluated by either the rest of the medical team or by yourself. Usually you have to be at ringside. You can send a local doctor to do further neurological checks. So these are the things that can happen when a boxer goes down. Just be always sure to never compromise the boxer's health for time, and use good medical sense, use the team around you, and remain in control. Let's talk about the most common injury you'll see as a ringside physician, which is a nosebleed. What will usually happen is one of the boxers will sustain an injury to the nose, the referee will stop the bout and call you up onto the apron to evaluate whether or not the boxer can continue or to stop the bout. Most times you'll be able to see what's going on before it happens. So as soon as you start to see flecks of blood on the face, start putting on your exam gloves because they're going to call you up there. Have your gauze, pen light with you, and evaluate. Now, evaluation includes checking the back of the throat for gushing arterial bleeding. If you see that, it's time to stop the bout, or gushing from the front. Usually it's a venous bleed that can be stopped by you on the apron if you just apply a little pressure. That doesn't mean you're trying to treat, you're just trying to see how severe it is. If you apply the pressure for 10, 15 seconds, but it's still gushing, it's time to stop the bout. Also, it's good to have at ringside some mini tampons and Vaseline to stop arterial bleeding. Never had to use it, but it's good to have on hand. You can also have on hand oxymetazoline, which is a vasoconstrictor used in sinus congestion to help stop bleeding. So you can take the little mini tampon, squirt the oxymetazoline on it, and insert it into the nose, and that can really be a significant help in stopping bleeding. Included in the nose evaluation is whether or not the nose has been broken. If you did the pre-physical examination, you'll notice that the nose has now angulated. Reduction of this fracture immediately is very, very important and very simple to do. It's not the most pain-free thing for a boxer to go through, but it's critical that it get relocated immediately. Usually, injuries to the eye are concerned with cuts, but common sense takes rule. If the boxer can't proceed because of pain or can't proceed because they can't see out of the eye, stop the bout. Now, whether it's caused by a corneal abrasion or detached retina, we can figure that out later. The general rule of thumb is if they can't see out of the eye, stop the bout. If the pain is too severe, stop the bout. Abrasions occur usually in the skull and the face, usually not too serious, and can be controlled with some pressure, light pressure, and some topical antibiotic. Very rarely do you need to put any occlusive dressing over it. And usually the coaches and the trainers can handle that. Most lacerations occur around the eye, around the face. Rule of thumb, again, common sense. If it's a very deep cut in a very critical area, stop the bout. Usually, most cuts can be controlled at ringside. If the cut is deep, however, and requires stitches, you have options. You can send the patient to the ER, or if you feel you have the skills, you can try to close it at ringside or in the treatment area. Remember, if you're going to start doing sutures, to start in layers. Now, once the cut is closed, whether you're using open or subcuticular, give an adequate suspension time if needed. Have the stitches removed within 5 days. Now, you're probably not going to be around for 5 days, so make sure that the boxer has a business card and a referral written on a prescription pad, if you have one, to their physician or a physician when they get back home. Let's talk about black eyes or hematomas. They're usually not that serious unless the swelling is so bad the boxer can't see out of the eye. So if a boxer in the ring has a bad swollen eye, can't see out of it, do a visual acuity check because you told the referee, I want to check this boxer. He went to his corner, the bell rang to start the next round. The referee said stop, calls the boxer over to the neutral corner, you come up, assess. He can't see out of his eye, she can't see out of that eye, bout's over. Hematoma of the auricle, or cauliflower ear as it's known. When this happens, this is a medical emergency. This is a disfiguring injury. So what has to be done is the bout has to be stopped if it happens in the ring. The boxer needs to be addressed later with the proper treatment. It's not a difficult thing to do, but some people don't feel comfortable. So you send them to the ER. If you do feel comfortable, do the procedure, apply the pressure, apply topical antibiotics, and a referral for follow-up once they get home. How about a septal hematoma of the nose? This is also an emergency because if not treated, it can lead to a septal defect. The treatment is a large gauge needle into the 18 to 16 gauge needle inserted into the hematoma and drained, then the nasal cavity is packed and the patient is placed on antibiotics. So again, septal hematoma is an emergency. How about a broken jaw? Broken jaw, 6 months out, mandatory. You're probably not going to fix it at ringside other than to stabilize. Now these next set of injuries we're going to go into are all about splinting, stabilizing, and referring. You're doing first aid medicine here. You're not running an ortho clinic. So stay within those bounds and you'll be okay, and the boxer will be okay. Let's talk about hand injuries. The most common hand injury will be to the thumb, usually at the DIP or MIP because of poor punching technique. Again, your job is first aid. If they come to you with this kind of pain, or if you see this kind of pain, splint and refer. You're not there to treat, you're not there to do any surgery or do anything invasive. Most limb problems you're going to find are in the shoulder. Dislocated shoulder is pretty common in boxing. Some doctors don't like to relocate without x-rays and proper medical facility to address any kind of complication when the shoulder is relocated. Other physicians are very comfortable relocating a shoulder in the ring or just outside the ring. They do it on the football field and they do it in soccer fields, so they're very comfortable. The idea is to stop the bout, do your first aid, and escort the boxer out. When you escort them out, make sure that the injured shoulder is the last part to come out. If you want to take them back to the medical treatment room and relocate because you feel comfortable with that, you probably won't have the time to do it because you're ringside and you have another bout coming in, but you can let the local physician do it or they can wait. Usually you want to get it relocated as soon as possible before the muscle spasms start to set in. Abdominal problems, injuries to the spleen. Now these may be difficult to assess immediately after it happens because it's usually a slow bleed that worsens over time. So if a boxer goes down because of a significant blow to the body and they're still having significant pain later, you may want to put them into the medical treatment room and assess them later. If it's worsening, taking their blood pressure and their pulse and pain evaluation, you might want to get them evacuated to the nearest ER for a CAT scan of the spleen or the pancreas. These are uncommon, but they do happen. Included in that category are injuries to the kidneys. So side pain, low back pain, or shoulder pain can all be because of a spleen or pancreas injury. If you don't feel comfortable doing any of these procedures, it's time to refer to the emergency room. Remember, you're there to provide first aid medical attention only. That's where you're expected to do. If you go beyond that, you're depending on your skill and acumen in that area. Now let's talk a little bit about the post-bout examination. These are usually very quick, very focused. You're looking for acute injuries. If you do find an injury, it's time to go into the medical evaluation area, or you can hold the boxer behind you if you think you want to take another look at those cranial nerves or ask some more questions about memory. But typically, it's a very quick exam as follows. So come on down. I'll help him down, make sure he doesn't fall. Sometimes these stairs aren't the most stable. Now, sometimes the boxers who have lost come out fairly upset and they don't want to be examined. Make sure you do the examination. Doesn't matter. If they're upset, they have to understand that the examination is a requirement. I'll usually do the person who lost the bout first so they can go. A lot of times the person who won the bout is celebrating. People are grabbing them, congratulating them. This gives you time to keep your eye on them. Don't let them get away, but go ahead and do the examination on the guy who lost the bout. That's the way I do it. So when they come out, I check for abrasions on the face. I look at the ears and the hematomas, look at the eyes. I do the once over with the cranial nerves here. Okay. Touch your head back. Let me look in your nose for any significant bleeds. Down here. Open the mouth. Okay. All right. Now check for shoulder and neck pain. Any pain in there? Okay. Any pain in the shoulders? Now let's see those hands. Now you usually have that wrap still on, but if there's any pain, you'll find it. Okay. Make a nice fist. Okay. Open up. Squeeze my thumbs. Okay. Good. Now I'm going to check for any injuries to the ribs. Everything okay? Anything you want to tell me? Nope. Of course, the mouthpiece has already come out too. You're cleared. Get back to the table because the next bout is getting ready to start. Of course, after you check the other boxer. Let's talk a little bit now about suspension periods for concussed boxers. Now, let me first say that none of the guidelines should take precedence over your medical judgment. There has never been any set of guidelines developed by any medical society that apply to all scenarios. So even within those guidelines, always use your medical judgment, and these are just guidelines. If you feel they need more time out, give them more time out. You hardly ever give them less time though. So let's say a boxer has their bout stopped because the referee feels they have taken too many blows to the head or too many unanswered blows, period. Minimum suspension is 30 days. Let's say that the boxer was knocked unconscious for less than 30 seconds. Suspension period is 90 days, minimum. Let's say the boxer was knocked unconscious for more than a minute. Suspension period, minimum 180 days. Now, let's talk about a second occurrence that occurs after a boxer has served their time out. So, if there's a second occurrence within 3 months of the first, in other words, they were injured, they did time out, they come back in, and within that 3-month period, they're injured again. Then the timeout is either doubled or tripled based on what the initial timeout was. So, if the boxer was out for 30 days, the resuspension is 90 days. If the boxer was out for 90 days, then the resuspension is 180 days. If the boxer was out for 180 days and he gets a third concussion, then the timeout is 365 days. Now, let's say a boxer was out for 365 days and comes back in and is injured a third time. Minimum suspension of 18 months. Then, if they get concussed again after that, it may be time for them to try a different sport. Now let's talk about how do you handle that situation at ringside as far as the paperwork. So the boxer's down, concussed, they recovered, now it's time to do the paperwork. They're going to be okay, but they need some time out. You have to have your affidavits in order. Injury report form and head injury affidavit are the forms you're going to use. They have to be signed and witnessed by the coach, the boxer, the examining physician, and the event sponsor. The boxer does get a copy of each one of these forms. The rest of the forms are taken, put into the passbook. The passbook is taken away from the boxer, turned into USA Boxing, and they'll hold the passbook for the duration of the suspension. Once that's over, it gets mailed back to the boxer. Now, to return to the ring, they still need to be examined again, either by their primary care, preferably a neurologist, or at least by the physician who does the next pre-bout physical that they've entered into. And that's how you handle it.